people have to go to the landing page and click on request your that is apply here, and you'll receive an email with a personalized link. So when you will click, it will be your name, welcome, like it's my name that is here. And if you are not, if I were not Charlotte Mbu, I should be able to click here to request my own personalized link. So I'll click on start. And here we are required to type in your email. My email is already here, so I'll just retype. And so when it's your turn, you should type your own email. You just make sure that there are no mistakes. And then I click on OK. And so why we ask you questions and what we do with your answers. So you may want to really go through all of these. There is our privacy policy that is there. And you can ask us any questions using the email. But the most important thing is for you to accept. You have to click on accept. Scroll right down, you click on accept. If you say you don't accept, you can't move forward. So, and now there's a question, does your direct supervisor at work agree with your participation? So we want to support you to advance your country's directives and policies and build upon guidance from the World Health Organization. But you are responsible for compliance with your professional obligations and regulations, including the duty of confidentiality for government and other employees. So I will say my direct supervisor agrees with my participation. So it's going to be yes. If you haven't asked yet, you can indicate the third option, which says I have not yet asked. And then we have the Scholars Pledge for Impact. It's very important to sign this pledge. And for members of the movement, we are very familiar with this pledge. So I accept. And then there is the commitment to confidentiality. I accept. And then now, personal information. The first is your gender. So click on the gender. And then your date of birth. It's important to type the day, the month, and the year, the number. So let me just go ahead and type mine. Okay. And then your WhatsApp number. So since this is the Nigeria Immunization Collaborative, it is by default the flag of Nigeria that is there, meaning your country. And so you just need to type in your number, your WhatsApp number. I am from Cameroon, so I don't have a Nigerian number. So I'll look for Cameroon here. And then I'll type in my WhatsApp number. And then you click on OK. So I agree to have my WhatsApp number and email shared with other members of the IA 2030 movement when required for activities. Yes, this is a peer learning exercise, and I definitely want to be able to connect and learn with colleagues from other states, from other LGAs, from other countries. So my response is going to be yes. And so now the next set of questions, I would like to know about your affiliation and focus. First of all, at what level of the health system do you work? So I'll say I work at a local government area. So you could be working at the local LGA level, at a health facility, at the states, at the federal level, multi-country or international. So for me now, I'll say I work at a local government area level. And in which country do I work in? For the purpose of this exercise, I'm going to indicate that I work in Nigeria. So I'm going to choose Nigeria. And the state that I primarily work in, so I'll go for Abia State because it's top on the list. And then one local government area, so I'll go for Aba North because it's top on the list. And then what organization are you affiliated with? I'll say I'm working for a non-governmental organization that's in Abia North in Abia State. And what describes your current role in the NGO? So I'll just indicate that I am a volunteer. And how many, in some cases, if you are government, it will ask you if you're a community health worker, if you are you know, a nurse, whatever. So you just have to pick out your role, or if you occupy more than one, then you go ahead and indicate how many years of experience. I'll say, okay, I have less than 3 years of experience. Okay, job categories apply to you. So I'll take the first. I am a community health worker. Okay, so you say here you can choose more than one. So I am a community health worker, and at the same time, I could say I'm a public health specialist. And so I say, okay. So to start your IA 2030 action plan, describe one priority challenge you face in your immunization work. And it's very important for you to read the description. So we suggest you focus on your most difficult and important challenge. Focus only on one problem where you can take action. Be specific about your situation, not generalities. Help others understand why it matters. Explain your situation. What is the root cause of your challenge? What will be different if you overcome this challenge? So in order to save time, I'm not going to go into all of those details, but I just really wanted you to pay attention to this. So I can say my challenge is low HPV vaccine uptake due to high vaccine hesitancy in my community. Remember, I'm a community health worker. So that's just an example. I would say because of it, they say go to explain the situation. They say since we started the vaccination, people have not turned out for sessions because of rumors on the internet or whatnot. But that is just maybe what I wrote. And then remember, now in one sentence, summarize your challenge, what you want to do about it. So what is your challenge? So my challenge is low HPV vaccine uptake due to high hesitancy. I want to, let me look at want to increase vaccine uptake through sensitization in my community. That's just an example, eh? It's just an example I'm giving. You may want to be more explicit when you are typing, and you have a maximum of 256 characters, and there is a possibility to download examples of challenges. So I click on OK, and the question now is your challenge too broad, general, or vague? And I'm going to ask you in the comments, if you can type in the comment, is my challenge, the challenge that I put, is it too broad or is too vague? Just let me know. And if you tell me that is too broad or is too vague, it's not specific, then I may need to improve my challenge. And then if I click on I need to improve my challenge, I will come back to it and I have to retype it. And if it's okay, I type it until it is okay. And then I can indicate here that it is specific and I can take action. So I go ahead and click, it is specific and I can take action. Okay, so now you all know we have the IA 2030 strategic priorities, and the Immunization Agenda 2030 has 7 different strategic priorities. So you review the list of the SPs, and you indicate, you select the SP that aligns with your challenge. So for me, it's going to be SP2, which is commitments and demand. So I'm going to take HP2, SP2. In some cases, it could be coverage and equity, but for me, I'll take it as commitment and demand. And then for each SP, there are what we call key focus areas, and the IA 2030 has 47 key focus areas that are classified under all the different strategic priorities. So you need to review the list carefully. And my strategic priority was SP2. So I come here, I can decide if I want to see only SP2 key focus areas. I can type SP2 there, and here I have only the key focus areas for SP2 that are showing, and there could be barriers for immunization. So I need to look for I need to look for a key focus area that applies. I could take barriers to immunization? And then, is your challenge related to any of this? I know the HPV vaccine is being introduced in Nigeria, at least in some states. So in my state, I call that it was introduced, and so it has to do with introduction of new vaccines. And so I click on that. And then, is there any other thing? Let me see, adults and children missing, reaching 0 dose, no. Disruptions, no. So it's really introduction of new vaccines. Here, there is a possibility for you to select more than one. So I took introduction of new vaccine and I click on OK because that's what aligns with my challenge. The question now, to tackle your challenge, define the goal of your IA 2030 action plan. So what will I need to do in order to tackle my challenge? So, and this goal describes what you want to achieve with respect to your challenge. And here you have a reminder. My reminder is my challenge is low HPV vaccine uptake due to high hesitancy. And I want to increase vaccine uptake through sensitization in my community. So my goal could be organize sensitization sessions in the 7 words of my LGA. That's still just an example, but that's what I want to do in order to address, that is sensitization in favor of HPV vaccination. So that's just an example, but I want to put that, and then I click OK. So why is this goal important? I'm not going to type all of that, else I'll take so much time. And what does success look like? So success for me will not just be organizing the sensitization sessions, but increasing my HPV vaccination uptake. So I could probably say HPV vaccine uptake in my LGA from, if we are, let's say 17% from, I can say 70% to 25% by, let's say, December 2024. And again, I say it's just an example. You have to think through exactly what you want to attain. And have you started taking action towards this goal? My response is no. So tell us about your stakeholders. So who are those, who will you need to work with to achieve your goal? What type of support will you need from the communities you serve? How should your organization, supervisor, and partner support you? What are your likely barriers to securing their support and commitment? What are you going to do if a stakeholder does not provide the support you need? Could the support of the IA 2030 movement colleagues be helpful to you? And if so, how? So here you really need to take time to type out exactly your stakeholders. So will be community leaders. And by community leaders, I have maybe, and I'm just religious leaders, women association leaders. So those are the stakeholders. What kind of support you in mobilization of the populations, in sharing of the flyers, responding to questions, whatever, supervisor. So you type all of that, and then do you need additional funding to achieve your goal? So usually we encourage you to carry out activities that will not require any additional funding, any additional funding or whatever. So what is really important is for you to think through. So if I'm going to be doing sensitization, usually is sensitization already part of my work? If it's yes, it means I already have resources to go to the field. So I can just add in HPV vaccination sensitization. So my answer will be probably no, I don't need any additional resources because that's an activity that is already budgeted and I am used to doing. So how much time will you need? I said, I want results by December. So I'll say 4 to 6 months. Okay. And then tell us more about the resources and timeline. It's just to say, okay, I will need maybe support from colleagues and supervisors but no additional resources, and should be able to meet my goal by December 2024. For example, that's just an example still. And I see Red also put in the chat that is women will be protected from, women and girls from cervical cancer. Okay, that's what success looks like. Now, we would like you to identify 3 different specific actions to achieve the goal of your IA 2030 action plan. We'll ask you questions about each action. Let us start with the first action. So if I want to carry out sensitization, what do I have to do? So maybe I want to do a community mapping. But you need to actually carry out community. You state it out clearly, community mapping. Have you done this before? Yes, probably I did it when it was COVID-19 vaccination. I did it for other vaccination, for 0 dose, for example. Yes, so I've done it before. Now I want to do it with HPV. And who will do it? Maybe I'll do it with others, with my colleagues, not alone. And so how much time do you need to finish these actions? So it should be less than 4 weeks. So 4 weeks or less. And how innovative is this action? How is this something? So maybe it's not very innovative, it's something that has been done before. So tell us more about this action. So you take the time to explain what it would take. So identify, maybe identify the quotas. I don't know. Yeah, just you have to identify the places, where the schools, the primary schools. You have to identify maybe out of school children in your community, where are they based? What are they doing? Are there associations that are in charge of that? Is women's association or mothers, caregivers, all of that. So it's that. And then we would like you to identify the second of 3 different specific actions. So now I'll have to, plan the different sessions by word. So in each word, where do I want to go to have these sessions? Is there a town hall? Is it in the Quarterhead palace, in the chief's palace? So where do I want to? So maybe that's what I want to, and the date, when and where exactly will I do? What will I need to do that? So again, have you done it before? Yes, or maybe no. Who will do it? I will do it with others. And then how much time do you need? It should still, for me anyway, it's 4 weeks or less. Is it innovative? Maybe not. Really, so tell us more. And then you take again the time to type in more. That's how will this action help you to achieve your goal? What needs to happen and when? What are the steps? So this is where you really put in all of the details. Who will carry out this action? How will you know when you have finished your action? How will you know if your action is successful? So, and then now the third action is really the hold the sessions proper. And then, okay, maybe have you done this before? Yes, still the same. You do it with others. So you need to, like as we said earlier, identify key stakeholders. And then depends on you if it's something innovative or not. And then you come again, you repeat the same process. You have to do this 3 times. And then what else needs to happen to achieve your goal? So what other actions need to be taken? Maybe follow up of vaccination sessions. That's one thing you need to, because it's good to sensitize, but afterwards, will the vaccination sessions take place? When they take place, is there any mobilization within? When will that happen? So that's just an example that I'm still giving. And then do you wish to share? So that is it for the action plan session. Do you wish to share experience to help you with your IA 2030 action plan and to help others? So yes. No, I am not interested. Yes, but I may not have time to do this. And yes, and I will prioritize this. So this is a peer learning exercise, and it's really learning from the experiences of others. So I definitely want to share my experience and also learn from the experience of others, especially those who have already introduced the HPV vaccine and are doing better than me. What did they do to make a difference? I want to learn that. So I will prioritize it. And we encourage you to share your challenge, goal, and actions in the experience sharing sessions. And you can also get help from others and also help others as well with their own challenges. Now, to understand your challenge and action plan, we have a few questions about the general situation where you work. So it is really about some of the indicators, the immunization indicators where you work. So the name of your organizational unit. So maybe I was at the Aba North LGA, for example. So I put that. And then in what type of setting is it? Let me just put it for the sake of the exercise as a rural. And do you know the size of your vaccination target population? So if you know it, you type yes. If you don't know it, type no. And there is nothing wrong with you not knowing. So there's nothing wrong with you not knowing. But if you know it, you type yes. And the closest estimate. So if I say, okay, 33,000, that's the population where I work. And then they ask the number of outreach immunization sessions that were planned and then actually carried out last year. Do you know? If you don't know, you simply type no. And in this circumstance, I don't know because I'm just a community health worker. So I don't know. So I type, I don't know. But if you know, you type yes, and then you'll be asked to type it. So do you know the ANC coverage, the antenatal care coverage in the local government area? Again, if you know, you type yes, and you type the number. So you just need to type a number. So if it's 55, you type 55. Don't add the percent sign, just type 55. And automatically it is recorded. We know that it's 55%. So you type 55 and you type, okay, so this is a percentage of women aged 15 to 49 with a live birth in a given time period that received antenatal care 4 or more times. So for the sake of the exercise, I put 55%. Now, do you know the current Penta-1 coverage in your LG, in your locality? So that is the coverage for below 1 year old. That is 0 to 11 months. So if you know, type yes. If you don't know, you type no, simply no. And then the Penta-3 coverage is the same thing. And then the MCV1 coverage, if you know, you type yes, and then you can say, okay, MCV1, we have 56. For example, you type, okay, MCV2. If you have introduced MCV2, you type yes, and then the coverage could be something like 42. So, and just type a full number. And then, has the HPV vaccine been introduced in your area? Is that yes, no, or you do not know? And it's okay if you do not know. So we'll type yes from my Abanot because that's where my challenge is. And do you know the coverage? Because it's my challenge, yes, I know the coverage. And I say, okay, the coverage is just 17%. That's why I want to take it to 20 something. So well done. You have now prepared your IA 2030 action plan. The question we'll ask you is, are you ready to take action? If your action plan is accepted, you'll be invited to join the Nigeria Immunization Agenda Collaborative to work with others to analyze the root causes of your challenge. So I am ready to take action. So I type yes. So what will you seek to achieve in the collaborative in a single sentence with an action verb? Describe what you will focus on in the collaborative. So for example, I want to learn from the experiences of colleagues' strategies to increase my HPV vaccination coverage. For example, that's my own example, just giving, yeah. So your example could be based on, but so now what is the most important action that you will carry out in the first 7 days of the collaborative? So in a single sentence, the action verb, describe an action that you will complete in the first week. So maybe I want to really understand the root cause of my challenge. That's an example that I'm just giving you. Okay, you type on okay, and now we'll ask you to complete your that is to complete your I-2030 action plan, write your full legal name. And please remember, this is the name that will appear, that appears on your birth certificate and your passport, because the name that will appear on your certificate. So here, I'm not just typing my first name and my last name, I am typing my full legal name. So you type your full legal name and you click on OK. So here you have to, before you submit, you certify I, Charlotte Dwambu, confirm that the information I have provided is true, accurate to the best of my knowledge, information, and belief. So do not forget to click on the submit button to send your application. And because it's a Nigeria collaborative and we know Nigerian colors are white and green, so we put a green submit button. So you click on submit. Okay, so we are thanking you. Receive a Thanksgiving message and for your application. We have received your application, and please save your full. Note that your full legal name has been recorded as, and the email that will be used to communicate with you is. So that is it. And then please invite a colleague. So you click on this link